Caring for patients in recovery, how we support you safely. Addicts, we worry about two things with our patients that have suffered from addiction. The first thing is their tolerance to the local anesthetic. Because we bring in an anesthesiologist that intubates and you are out, we don't have to worry about that. We will have you numb and you'll wake up from the surgery without having felt anything. That's the first thing. Frequently their tolerance can be higher than the next person's. The next thing we worry about is keeping them comfortable. But because, like we discussed, taking one tooth out, it hurts like heck. Taking a mouthful out, we're gonna block your inflammatory response. You're not gonna deal with swelling. You're not gonna deal with the pain you would normally deal with, to where we don't have to flirt with narcotics if you do suffer from addiction, because they're unnecessary. And if every patient didn't tell us the same thing, I wouldn't tell that to you. But we'll find they're unnecessary, but we do have techniques of using a prolonged local anesthetic if we need to for that option. So you're not gonna hurt afterward.